When you think about Sjogren's disease, you probably think about the dry eyes, dry mouth, the fatigue, body pain, but there's something else we need to talk about. And that's something that often gets missed in our 10 to 15 minute doctor's visits. Hi everyone, Dr. Kara Wada, quadruple board certified allergy, immunology, lifestyle medicine physician, and a Sjogren's patient. Like many of you, I know that navigating this complex autoimmune condition, the dryness, the fatigue, the uncertainty of symptoms seems to change day by day. But today I want to talk to you about something that often gets overlooked, your heart. There's a silent but significant cardiovascular risk that comes along with Sjogren's disease. And the standard advice is just to check your cholesterol once a year. And that simply doesn't cut it for those of us living with a systemic autoimmune disease. Over the next few weeks, we're going to dive deep into the connection between Sjogren's and other autoimmune diseases and heart health. We'll talk about the numbers you need to know, the questions you need to ask your doctors, and the proactive steps you can take to protect your long-term cardiovascular health. Today, in this first video, we're going to talk honestly about this risk, why the usual guidelines may not be enough for you, and what you need to be aware of. So let's dig in. So what's the connection between Sjogren's and cardiovascular disease? At its core, Sjogren's is a disease of systemic inflammation, and I want to emphasize that word, systemic. Whole body. That chronic low-grade inflammation is like a fire that's burning inside your body, and it doesn't just stay localized in your salivary glands or your lacrimal glands, the ones that produce tears. It doesn't just affect your joints when they're achy. This inflammation affects your entire body, including your cardiovascular system. It's your heart and the delicate inner lining of your blood vessels, which we call the endothelium. Now, research has shown us something really important. Women with Sjogren's disease have a significantly increased risk of cardiovascular events compared to the general population. We're talking about heart attacks, strokes, and other serious cardiovascular complications. Some studies suggest this risk is elevated by 20 to 40%, and some research indicates it could even be higher depending on other factors like disease activity and duration of your disease. And I want to be clear, I'm not sharing this information to scare you. I'm sharing it with you to empower you. Because when we know about a risk, when we understand it, we can take meaningful action to address it. Knowledge is really power when it comes to your health. The challenge is that many of us have been told our cholesterol is fine or our blood pressure is okay. And so we think our heart is doing well. But for those of us with Sjogren's, there's more to the story. And here's the fundamental problem. Standard cardiovascular risk calculators, i.e. the tools that your primary care doctor or you have a cardiologist might use to assess your heart health, are designed for the average person. Well, my friend, you are not average. These calculators take into account things like your age, whether you smoke, your total cholesterol, and your LDL or your bad cholesterol levels, and your blood pressure. And these are all really important factors. Yeah, don't get me wrong. But these standard calculators often fail to account for the single most important risk factor for us, chronic systemic inflammation. So what does this mean in practical terms? It means that this underlying inflammation can damage the lining of your blood vessels, that endothelium. It can promote the formation and buildup of plaque, and we call this atherosclerosis. And the kicker is this can all be happening even if your traditional risk factors like your bad cholesterol, your LDL, look pretty normal on paper. So you might have an LDL of 100, which is considered pretty good, and your blood pressure may be 120/80, textbook perfect. But if you have high levels of systemic inflammation going on day after day, month after month, year after year, you're still at an increased risk. And that's the gap in standard care that we need to address. So as someone who lives with Sjogren's myself, and happens to be married to a cardiologist, this topic isn't just academic for me, it's deeply personal. And this is something I am working to be more vigilant about in my own health. I know that I can't just rely on standard checkboxes at my annual physical, and I can't assume that because my cholesterol looks relatively okay on paper that my heart is protected. I need to be proactive. And so what do I do? What are those questions that I can ask? And what are those inflammatory markers we can look at? What are the lifestyle factors that maybe go beyond the generic advice that's given to that average person? As a physician, I also see this same challenge play out with so many of the women I worked with. I see patients who are doing, everything right, checking all the boxes. They're eating a balanced diet. They're trying to stay active the best they can, with fatigue and joint pain. They're taking their meds as prescribed. They still have this underlying inflammatory risk that isn't necessarily being fully seen or addressed by the standard guidelines and standard of care. One of the most frustrating things I hear from my patients is that, my rheumatologist said Sjogren's is relatively stable, and frankly, we don't have any other medications to use at this moment. My primary care doctor says my heart looks fine, so I guess I'm good. And I have to gently say that that's wonderful that things are stable right now, but are we being proactive about your long-term cardiovascular health in the context of this chronic inflammation? And often the answer is, I don't know, or no. And it's not because anyone's doing anything wrong, but the system isn't set up to connect these dots for us. And this is what I want to help change. So where do we start? How do we move from feeling like overwhelmed, which is where I have been, to worry, to feeling empowered and proactive? And the first step is simply knowing that this risk exists. You're already doing that because you're watching this video with me here. So high five. This knowledge really allows you to shift from being a passive recipient of healthcare to really becoming an active, informed partner in your own care. It empowers you to start having a different, more nuanced conversations with your healthcare team, whether it's your rheumatologist, primary care doc, cardiologist. And here's what I want you to do after watching this video. I want you to think about your last conversation with your doctor about heart health. Did anyone talk about inflammation? Did anyone discuss how your autoimmune disease might be affecting your cardiovascular system? Or was there even a quick check of your cholesterol or your blood pressure? And maybe then you were just on your way. And if it was the latter, it's not anyone's fault. But this is an opportunity for you to speak up at your next appointment. You can say something like, I've been learning about the connection between Sjogren's and autoimmune disease and cardiovascular disease. And I understand that chronic inflammation can be a risk factor. Can we talk about my specific risk and what I should be monitoring beyond just my cholesterol? That one question can open up an entirely different conversation. It positions you as someone who's informed, engaged, and taking your health seriously. And most doctors will respect that and rise to meet you there. So let's recap what we've covered today. Your Sjogren's is more than just dryness. It's more than just fatigue. It's a systemic inflammatory disease. And that means we need to be extra mindful and proactive about heart health. The standard cardiovascular risk assessments that were designed for the general population often miss that inflammatory component that's really critical for us. And because of that, we need to advocate for a more comprehensive approach to our cardiovascular care. In the coming weeks, we're going to go deeper. Next week, we're going to get real specific about 7 key numbers that every person with Sjogren's should know and track. These aren't just your standard cholesterol and blood pressure. We're going to look at inflammatory markers, metabolic health, often overlooked indicators that give us a more complete picture. So let's recap what we've covered today. Your Sjogren's is more than just dryness and fatigue. It is a systemic inflammatory condition, and that means we need to be extra mindful and proactive about heart and metabolic health. Standard cardiovascular risk tools were built for the average person, and we're above average, and they often miss the inflammatory piece that's so critical for people with Sjogren's and other misbehaving immune systems, especially autoimmune diseases. That's why we need to advocate for a more complete picture of our risk and care. In the coming weeks, we're going to go deeper. Next week, I'll walk through the 7 key numbers I want people with Sjogren's to understand and track over time, not just cholesterol and blood pressure, but inflammatory and metabolic markers that fill the gaps that the usual tools miss. If you want help turning today's information into actual support, here are a few next steps that you can take right now. First, you can join our free community. Come join us in the Stronger Sjogren's Facebook group. It's a calm, moderated space where we talk about topics like this, share resources, and you get to hear how others are navigating similar issues. Link is in the description. If you'd like to get this whole Sjogren's Heart Health series and future virtual Sjogren Summit details delivered straight to your inbox, there's also a link below to join my newsletter. That's where I share deeper dives, checklists, and updates as they're created. And if you already know that you want 12 months of structured support around movement, nervous system health, cardiometabolic risk, stressors, alongside your medical care, you can learn more about the Stronger with Sjogren's program at the link in the description as well. But before you go, make sure to subscribe, click the bell so you don't miss any of next week's videos, and especially that one on the 7 critical numbers. Like this video if it was helpful, share it with a friend, and in the comments, let me know, have you ever had a real conversation with your doctor about heart health in the context of your autoimmune disease and Sjogren's? And what is the one question you still have after watching this? Thank you so much for being here and for caring enough to learn about this piece of your health. I'm Dr. Wada, and until next time, take care.